So this is a topic I have been wanting to do for a long time, you guys, because I've just noticed throughout my career that there is certainly a lacking of maternity care in certain aspects, but this I think is one of the most efficient areas. And it's really just how we treat women who have pregnancy losses. So we're going to talk about that this evening. I want us to kind of discuss just where we are in the US, how we view pregnancy loss, and what we're doing right, and the things that we certainly can be doing better. So one of the things that I first stood out to me is, as you guys know, when a woman has a live birth, she has a maternity leave, a time period or postpartum time period that she is allotted to recover from her childbirth experience or from her pregnancy. But we don't really have the same allowances when it comes to women who have pregnancy losses. Certainly, with the exception of those who have full-term losses, who may actually get that time off, but in most part, most women don't. And there seems to be a societal expectation that a woman who has a loss should be able to return to work immediately. What do you guys think about where we are and how we treat pregnancy loss and recovery? What do you guys think about our attitudes towards it as a society and how we view it and how we support, or maybe we don't support? I mean, I have my opinion. What do you guys think?
Okay, well, as a mother who also had an elective abortion, I chose to terminate a pregnancy in the past when I was in college. I was 24. My situation was a little different because I terminated it, but it still was very emotionally and psychologically overwhelming and damaging for me. So I can only imagine a woman who didn't choose to elect to terminate and had a miscarriage, right? So I remember just crying for weeks, and not just that, but the physical pain and changes that were happening in my body. So I was dealing like twofold, like the emotional and psychological pain, and then the physical pain of the pregnancy ending, of bleeding for days, cramps for days, just tired, sore, my breast. Like I was very vulnerable and needed a lot of support. And I did have to go to work like within 2-3 days after my procedure. And it was hard because I had to carry on like nothing had happened. And, you know, just not something that you could just talk to coworkers, you know, during lunch, you know?
Right.
It's something that's still very much a taboo. And I think our society does a really terrible job at discussing, you know, miscarriages and stillbirths. And it's like, oh, it's like a hush hush. We know what happens, but nobody really wants to talk about it because it's so painful to bring those conversations to the surface.
Yeah, and thank you for sharing that. And we're definitely going to talk about the specific circumstances of the recovery of termination of pregnancy, because I think that's also another unique experience as well. But to your point, I definitely do think that there's an expectation that a woman should get over pregnancy loss really quick. And I'm not quite sure where that expectation derived from, but it just kind of feels that way. It kind of feels like from her career standpoint, her employment standpoint, the medical standpoint, we don't do the same types of check-ins as we do by standard for women who have live pregnancies. It's really an interesting perspective. And we certainly do not address the men who had the pregnancy loss. There's absolutely no approach for that. And we don't even discuss the men when it comes to full-term pregnancy losses like IUFDs, intrauterine fetal demises. The men are not a part of the equation at all. So there's definitely a complete lacking from a paternal perspective. But from the mom's perspective, I like the fact that you mentioned that there were still physical changes that were taking place, right? You know, pregnancy hormones don't suddenly drop off and become zero and go back to negative immediately. So for a lot of moms, you're still experiencing the physical changes that you experience with pregnancy, the breast tenderness. You may still have that nausea. You certainly will still be bleeding for some time. And let's talk about like the grieving process. Do women who have pregnancy losses grieve?
Yes.
Yes.
I think for like my own personal experience, I've lost two. I had a miscarriage, I bled out, and then my second one, they had to go in and get, so I had a DNC on the second one. But to your point, the question on the first one, Tasca, I was um I was 15 when I was pregnant. And at 15, there's a point of like, I don't even think I completely 100% understood what was even happening to my body. Like, I know how to get, I mean, clearly I was pregnant, but looking at like chunks of matter, whatever it was, I knew it
Products of
wasn't like,
conception.
yeah, like I knew it wasn't blood clots in the sense of it wasn't my period. I knew that much. So, but not even as a 15-year-old person, I don't think I understood. I don't think I fully understood what was happening to my body until actually I was a lot older. Because from that point, like I stayed home from school a couple of days. My boyfriend at the time came over. We were both young as hell. We really didn't, neither one of us, we understand pregnancy, but the fact that I never came to full term or anything like that, he moved on with his life. He's married with kids, blah, blah, blah. And I still think about it because sometimes I'm like, oh, I would have had I'm 42. I would have had a kid who was like 26 or 27 years old right now. That blows my damn mind. So I think of it in that sense, like, damn, I don't know how far along. It wasn't far enough along. I was pregnant, but like I never got to meet this person. I never got to feel anything. Whatever your body is supposed to do, my body did not do that. One thing what I didn't do was I never blame my body for that, which I think is also important for a lot of women, is not to blame. Like I was 15, it wasn't meant for me to have nobody's damn kid at 15 years old. So the universe knew something that I did not. So be careful how you treat yourself and what you say to yourself. But at 22, I was in college at 22 when I had the DNC. And when I tell you, do we grieve? This process was a little different. Because I still have the marks. I live with that every day, and I also think, okay, I would have had a 27-year-old and a 20-year-old. Like, God damn, like what my life would be like, and what would have been their names, and who would they be? What kind of people would they be? What kind of mother would I have been? So not only did, you grieve those losses when you lose them, as a 42-year-old woman with no kids, I grieved the loss of the idea of what I thought my life was going to look like, or what the expectation of what my life was going to look like, or what society said my life would look like. And it doesn't resemble any of that. And so trying to find my place in the world as a woman who lost children, who has lost, but then who may never have a child either. So that's the other side of that, is I lost children, but then at an age where I can actually afford kids, I'm okay to have them.
Right.
Will I have them? So that's twofold for me. So yes, to answer your question, the long way around the cranberry bush, yes, we do grieve the losses of
children. And I think that's really interesting. And thank you for sharing that, Chassie, for sharing your experience. I think it's really interesting that a lot of people don't really think of the grieving process in terms of the loss of a child. And what really struck out to me is the fact that you said that you really still count the years of their birthday, as any mother would do for their child, right? Any mom who may have lost a child later in life, as a toddler, as a teenager, you continue to count the birthdays and celebrate their lives. And I think that society doesn't really look at pregnancy loss as the loss of a child. And I oftentimes try to share that with my patients, like it's okay to grieve as you grieve the loss of a child, because it is the loss of a child. And so, what was that grieving process? What is that grieving process like for women? How long does it last? Can you go straight back to work? Eunice mentioned that she went back to work 2 to 3 days later. How do you even do that? First of all, from a physical standpoint, but certainly how do you do that from an emotional standpoint? How much time should women be given off after they've had the loss of a child?
I think it depends on how far along, and I mean, would it, let me say this, would it depend how far along off you were in pregnancy? Even though, let's just say you may have been pregnant and you had a stillborn, so you had to deliver, technically, you know what I mean? So that was let's say maybe a full-term baby, or like, I don't know, it was that you were months along that you still had to deliver. You know what I'm saying? So,
Yeah.
How hard is that to deliver a child,
To
is
labor.
and so you got to deal with that. You got to go through the whole feeling of that. So I don't know, like for me, I was 15, so my body was just like, boom up, just I was tired for a couple of days. 22, still young. I was only down for a couple of days, and then hell, after that, I moved to New York. So I think people deal with things, pain and loss, differently. I think it depends on how far along you actually were in the pregnancy. Maybe I'm not 100, but for me, I was so young both times. It was just, it is what it is. I can't get those kids back. One part was like, I'm moving to New York, so I was a little excited. So I was like, okay.
Yeah,
And the
you
other
had
thing
other
was,
things on our rising.
right. And the other thing was like, it wasn't meant for me to have kids at that time, nor was it meant for me to have one of those kids by the person I was pregnant by. So I was kind of okay. You know what I mean? So
yeah. I think it's
I don't know.
interesting. I think it's an interesting point because certainly physically, it's a different recovery process to have a full-term stillbirth versus a first trimester loss. But I will definitely tell you, in my career, I have seen women grieve significantly with first trimester losses, as much as I do women who have later pregnancy losses. And the question is like, how do you draw the line? Like, who do you determine has 6 weeks versus 8 weeks versus 4 weeks versus 2 weeks? How do we make that decision as a society, taking into consideration the physical and the psychological process of grieving? Like if you talk about, for example, a woman who was infertile and she finally got pregnant after maybe IVF, so financial investment and things like that, and she has a pregnancy loss. Like, how traumatic is that? And that may have been a first trimester loss, but her grieving and her experience of loss may be exactly the same as someone who had a full-term stillbirth.
I mean, I agree. I think that that's probably even more traumatic in itself, because the amount of effort and financial
investment
that when I got stuck there, I was just trying to I would be devastated knowing that I probably spend thousands of dollars, because IVF is really expensive. And then not only did I spend thousands of dollars, I put my body through all the rigor of IVF, and then I lose it. Like that would feel like the death of a parent, or like very, very intense. It just deplorable loss. It would just be a terrible tragedy. I just don't know if a woman can bounce back a week, 2 weeks after that. I could see somebody going into like a severe depressive episode.
And some people do.
They do. I mean,
yeah.
I know people, I've worked with people like that, and how can you not, and then as an employer, how can you expect somebody to come back to work and function
immediately after?
I mean, that just seems so inhumane, and just the thought of it, like, it saddens me.
And I think, you know, I think part of the challenge is also that a lot of times, like you mentioned earlier, Eunice, this is something that's not often disclosed, right? So some women have early pregnancy losses and they may not have even told anyone in their family. No one knows that they were even pregnant. And so oftentimes there's that isolation that occurs as a result of just the lack of disclosure. And so your boss may not have even known that you were pregnant. And so then how
Can I
laws
add to that? Can I add to that?
Mhm.
I didn't tell anybody that I was pregnant with my now daughter, who's
Mhm.
6, until I was in my second trimester. I was a grad student and I was doing my clinicals at a hospital, like at a children's hospital. And I didn't tell my immediate clinical supervisor until I was like 4 or 5, until I started showing. And she asked me, "You're gaining a lot of weight." She's like, "I'm sorry, but are you pregnant?" I was like, yeah. I didn't want to tell anybody. I didn't tell any of my classmates in my seminars, in like my graduate program. I didn't tell anybody until I was literally showing and people were already like putting 2 and 2 together, because I just didn't, it was nobody's business. I didn't want people knowing that I was, you know, a grad student pregnant.
So then how do we balance the privacy of women of not disclosing the fact that they're pregnant and at the same time allowing them the same care and recovery that we do for someone who have a live birth experience? Why isn't this being talked about? Why aren't we doing better?
Because we live in America. That's why.
And what exactly does that mean?
I mean, look at Canada. Look at some of the Western European nations. Look at some of the other countries that have such progressive maternal laws and leave. Like, I remember my cousin in Canada, in British Columbia, she was off for like, I think it was like 7 to 8 months after each birth. It's like 20 something, like 27, 20. Like, I saw a chart the other day and it said like the most progressive maternity leave. And it's like, I think it was like Sweden and Germany, and like Canada was up there. And it was like, I did the math and it was like 27, 28 weeks, I think. I was like, yeah, that's about right. No wonder my cousin's on her 3rd baby now.
Nice.
You know,
right. Yeah, you give us more time off, we may produce a little bit more for you.
I mean, I'm just saying, like,
totally. And even from the mental health perspective, like, we're getting a little bit better. We're still horrible with screening for depression, anxiety, postpartum, but at least it's gaining attention. But we don't even check in on these posts. I mean, that's my particular practice, but as a profession, we don't really check in on women who have pregnancy losses.
No, we don't. And a lot of us, I will say us, because me included, like, suffer in silence and like suffer so much that, like, if I were to ever be pregnant, I don't know if I would tell any, outside of the person whom I'm pregnant by. I don't think I would tell anyone, because I don't want to explain if I have a 3rd miscarriage. And the other part of that is, if I were to get pregnant again, I am fearful that I can get pregnant. Staying pregnant is my issue.
Right.
So, I don't know. I wouldn't tell, like, one of the happy, if I were to ever get pregnant and make it past certain, like, I wouldn't want a baby shower. I wouldn't want anything until I know that the kid was here. And for the simple fact, it would be what you call it, a geriatric pregnancy, clearly, because I'm 42.
Advanced maternal age.
Huh?
Advanced maternal age. I hate that geriatric code.
I do too, but I'm like,
I mean, girl, I'm right there with you. I'm 36, so I think after 35 is considered geriatric, right, Dr. T?
Advanced maternal age, yes.
Yeah. Thank you for the reframe.
I like the reframe. That's a good reframe.
Yeah. So I don't think either way it goes.
After your 35th birthday. So even if you're 35 at the time you're pregnant and you deliver after your 35th birthday, yes, it's advanced maternal age.
I'm 36 and 3 months.
So either way it goes, I wouldn't say anything to anyone for fear of losing a pregnancy again and having to explain it all over again, should I choose to explain it, or dealing with the thought of, being pregnant and just dealing with the psychological fact, like, if I lose another kid, I don't want to go through, although I was young, I don't want to go through that ever again. So much so that I'm like, I may not have a kid.
I hear you. I hear you. And I
know.
think I definitely hear it and definitely understand the logic of doing that. I have a lot of women who make those same decisions because, you know, it's hard enough to even deal with the reality, needless to say, to have to help other people process through their grieving, because other people do grieve the loss of pregnancies from someone else, you know, as a father, as a mother of the child, of the lady that had the miscarriage and things like that. So then you have these extended grieving process. Your best friend may be grieving on your behalf. But I definitely do think that the medical system has the opportunity to be that support system. You know, we should be screening patients who have pregnancy losses for depression and anxiety. We should be screening, we should be doing check-ins as we do with postpartum patients. If I have a postpartum patient who has what we consider I hate the word poor, but unfortunately, that's the ICD code, a complicated obstetrical history, right? And I know that she's at risk for having sort of these mental health challenges with her current pregnancy, then we do more check-in. You know, we screen more, we call more, we give them more visits to make sure that we're not missing that downturn if she were to have a downturn. But we do not do this type of check-in with pregnancy losses, you know, and they come back to the office and the protocol is, you know, what do you want for birth control? What's your family plan? What you think? And that's a lot to process. If you're still processing your loss, to then have to decide what is your family planning is really, really a challenge. And so I try to be led by my patients with those types of discussions, but I can't say that that's the norm. Unfortunately.
I don't think no one ever checked in with me. Not that I gotta watch my eyeballs. Not that I can not that I can recall, but I do know mentally it still does have a minimal effect. Can I say minimal? I'm not even sure. It still has an effect on me. So much so that it's affecting like life decisions that, you know, that I can, future decisions that I could, you know, potentially make. So it affects you, you know, both were 27 and 20 years ago. It still has some sort of
impact on your life, right?
Yeah, some sort of impact. Absolutely. Because even though, let's just say like for being a single person now and, you know, dating, I got to be clear, like, dude, if do you want kids? Do you already have kids? And that also changed my perspective because when I was dating younger, I didn't want a man with kids because I wanted to be, you know, I wanted us to have that connection together. You know what I mean? But now I'm like, I hope you got a couple.
How aging changes you.
It does. And then like not having, you know, limiting expectations on yourself. Because now I'm like, well, I hope you got a couple kids because of and I hope you done because I can't, because I'm gonna have to be, if we together, I'm gonna have to be enough. Because I can't assure you, I can't ensure a kid unless we have another idea of how to become a parent, like adoption or whatever have you. But those that it has changed my perspective in like whom I choose to date. If you have kids, I'm cool. And I mean, not like you got like 12 and everybody under 12. I ain't talking about that. But you know, like if you're done having kids, I'm cool with that. If you have them, I'm okay with that. Just keep the pressure off my uterus because I'm not quite sure how. No, I'm just saying.
Yeah, no, it definitely.
Front and I'm clear. Up front, like, listen, I'm giving you the best I got. And hey, I'm gonna have to be and come on, Anita. I know where you're going.
I know that's right. She said, giving you the best I got.
Give me the best I got, and my head went straight to Anita.
I'm with you, sis. I'm with you.
But I think a lot of it is also financial, right? Because somebody's gonna have to pay for women to be out on leave after they have a miscarriage. And if you think about the number of women who have miscarriages, you know, it's so common to have at least one miscarriage in your lifetime. You're talking about, you know, money is essentially at the bottom of this, I think. And certainly the lack of value in childbearing, in fertility, the fertility of women. And also the fertility of couples. I'm not going to leave the men out because men do grieve losses, and oftentimes there's a challenge because the partner is so focused on the woman's recovery that they themselves don't go through their own process at all. So I definitely think we can do better financially and financially back the support of women so that if a woman needs to take time off, extended time off, you do have some women who recover quickly. They have really good support systems and they're focused on, their next step. But then you do have women who grieve a lot, and we should have a system that we allow for them to have that space in that moment. Because otherwise you deal with anxiety in the next pregnancy, depression in the next pregnancy that could have been
PTSD too. PTSD.
Exactly.
And then maybe we should incorporate like preventative mental health. Like maybe, if you're going to become pregnant or you want to try again, then maybe you do some therapy sessions prior to getting pregnant again so that you can process some of the trauma, like preemptive. Like we're always so reactionary in this country when it comes to treatment. Like everything is like after it happens. Why don't we do some preemptive work so that we can address the anxieties, the trauma, the depression, and we can formulate a plan so that if this happens again, we can at least talk about it and you can at least be mentally prepared for worst case scenario, right? Because I'll be honest, another reason why I don't want to have another kid is because I'm 36 and that's the reason. I'm older. And if I have a miscarriage, I don't know if I'm going to be emotionally able to get back and function like I'm doing now. You know what I mean? Because I know how bad it was when I had the termination when I was 24, when I had to terminate, even though I chose that. It still affected me and it tormented me for years. And like Chastity said, I still count the years too. I would have had a 12-year-old right now. I still have dreams of this child. I've had dreams.
Wow.
And I terminated. So I feel like I was the worst mother. I ended it. But I was 24 in college. I had nothing to give this child. You know what I mean?
Yeah.
So I think like her, I would have had a 6-year-old and a 12-year-old right now. What would that child look like?
People don't know this though. I feel like people really don't know. I've heard stories like this from my patients also. And I think in general, I don't think a society really knows this. I don't think society knows or even cares to know, but definitely don't know that women who have losses of any kind, whether it's from elective terminations of pregnancy or from miscarriages, that you guys are still celebrating the life of that child. Like you acknowledge the life of the child for your entire life, and that's not an unusual story. That is actually the more common experience for women who have pregnancy losses. At least from the stories that have been shared with me that I'm privileged to hear. And that's why I feel like this is such an important topic, because I feel like this is a forgotten area. And especially for women who have recurrent losses, it's even compounded, as Chastity has shared. It's a very compounded experience. And it does make a difference as to how you view your fertility, how you view relationships. And it changes a woman in a very unique way. So yeah, I agree with you, Eunice. I think we are very reactionary. I think we need to have more conversations like this, and I hope that we do. But if they're not going to talk about it, we are going to talk about it. Why? Because we're Healthy Bump Club and we talk about everything. Okay. That's just what we do. So we're going to go around today. We're going to ask everyone today, and the question of the day is, I almost forgot what my question of the day is. We gonna remember it. Okay, come on, Dr. T, bring it back. All right. The question of today is, what is your favorite movie? All right, we're gonna go around, starting with the mental health provider, who is to my, well, it'll be confusing if I tell you what side she's on, but she's on the top with me. Come on, Chastity. Where can they find you? What is your favorite movie?
You can find me at miss._CHAZ on Instagram. And my favorite, okay, I'm just going to say Best Jones, because it's a combination of Best Man and Love Jones. So I'm going to say Best Jones.
Oh, for me. Okay.
So I'm just going to say Best Jones, because I'm like, they're right there. It's Best Jones.
Is that Best Man 1 or 2? And we
one.
still waiting for number 3, y'all. We still waiting.
2 was great, but like one, bite it, Spivey, grow it, Murchie. Like I we know words. I know that movie like I know Color Purple. So I'm gonna say Best Jones. Best Man Love Jones. There we go. Or Man Love. I don't know. Love Man. I don't know.
You
Whatever.
just made it hard for me. I thought I knew what my favorite movie was, but you just threw a wrench in there. Okay. Come on, Eunice. Where can they find you? What is your favorite movie?
Okay, so they can find me at Eunice, EUNICEDA, the therapist, at Instagram. And my favorite movie is what Chastity just mentioned, Color Purple. I fell in love
That's
with
a good one.
I fell in love with the book when I was a young girl, and I fell in love with the movie. And because I was so young, my mother didn't really want me watching it because there was some, inappropriate scenes, but I would sneak and watch it.
What's going on?
I would sneak and watch it. So yeah, The Color Purple. I just fell in love with the book.
Wow, you guys, you're learning something.
Papa, who this woman?
All right.
Yes, that's my favorite.
Yes, until you do wrap up. Okay, yeah.
Everybody, yes.
And then we
right.
shall never
That is a classic. That is definitely a classic. Oh my gosh. Well, I thought I knew what I was gonna say until Chastity reminded me of how much I love Jones and how many times I've watched it.
It's on Netflix now.
I know it is. Don't remind me. Because I just went to see it the other day in an outdoor cinema because I will do that again.
Yes,
oh my gosh.
And I also, in that genre, I also love my hip hop love story, love basketball. Love and basketball. I'm sorry, not Love and Basketball. I'm sorry, Brown Sugar. I'm sorry.
Brown Sugar. Yeah.
Clearly, I love them all. Clearly, I love all the
Diggs.
romantic comedy. I meant to say Brown Sugar, but I do love and Basketball as well. However, my favorite movie may surprise you. It is The Usual Suspect.
I'm clicking off of here. I'm out. Good night.
The Usual Suspect.
Good day.
I love that movie. It is such maybe it's the gangster in me. Am I gangster?
Oh,
that's
no,
that New York. That's that New York.
Yeah,
that's the New York. Yeah.
It may be the gangster in me. I love trying to figure out things and seeing where the story is going. I love stories that kind of are very provocative in that way. So that has been a all-time favorite.
Dr. T got some inner thug in her.
Okay.
I do. This is why I love the Bad Boys. It's a shame, but it's a shame. This is the problem. But yeah, no, I love that story so much. And I almost got heartbroken with the whole controversy of the lead star, but we're going to leave that there. But I still love the story, and the ending of the story is the most amazing scene ever.
I gotta go watch it again. Wow. Okay, Doc.
It is the most amazing scene ever when everything comes together. And you guys who watch The Usual Suspect, you know what I'm talking about. That walk outside is like, bam. Okay. All right. I am Dr. T.
Do you like the movie, Doc?
I love the movie. I am Dr. T in the hand behind the handle of Healthy Bump Club. And this is my inner gangster. Yes. We thank you guys for watching. Make sure you hit us up with your question of the day. We will answer it on our next episode. You can find us at Healthy Bump Club on Instagram at healthybump.club. We love that you're watching. We thank you for watching, and see our next episode here. You will see a line at the top of this video that's leading you to another video. Make sure you watch all our videos. Thank you guys for supporting. We'll see you guys on the next